I just started saying, God, I can't do this. I need help. I need help. Now, the first thing about the anxiety was, when I realized I need help, the second thing was I had to want it. You gotta want help. You gotta not want to be stuck. And sometimes it doesn't require a therapist. Yes, I'm a clinical Christian counselor, Christian therapist, I should say. Yes, I am. I'm a clinical Christian therapist. But everything does not require you to see a counselor or a therapist. Some stuff is in you and your relationship with God that can help you overcome the anxiety. You can do some things about it yourself. You can just like.
Okay.
What? Go ahead.
Okay. Let's say this is you need to always bring who you are and what's still gonna make us money. You know? Like you've made the point that anxiety is not supposed to be, it's not basically that you're anxious. It's not basically that you're crazy, and you could just like you self-help yourself.
Okay.
I need you to talk about, but there are a part of anxiety that is chronic. Okay. That is called the DA.
Okay.
I think it's
it's on there.
Yeah.
It's called,
and that with that one, with the general anxiety disorder, GAD. With that one, you need help.
Okay.
And I think if you go through it, you
go
can
through
now,
each one of them.
you can now talk about how you might seek counseling. The following ones, so you might.
Nice. Okay.
But I need you to talk about, let's talk about that one first. Okay, with this one, the GAD.
Okay.
Then you talk about the symptoms, talk about the physical symptoms first.
Okay, and then go to the GAD. Okay.
And then the inside symptoms.
Okay, so I did one. I covered this one. Okay, that's all right.
So now physical, you can say, but there are the part of anxiety that is really, really problematic, that you really do need help, that you yourself cannot help yourself. Because the kind of anxiety that you were having, that you have yourself, is just the one that is a fear. There's a difference between fear and the major anxiety that is now like a problematic one. Like a chronic one, which is called the GAD, you need counseling.
If you are diagnosed with GAD, general anxiety disorder, you will usually have to have some of the following symptoms.
Yeah.
So if you have this, you have fear.
You have fear.
You have feelings of restlessness, and I'm gonna have to look at the paper for this one because it's a lot. Okay, but I got it.
Yeah.
So I'm gonna start off right here. The sensation of having.
And these are the physical ones. These are the physical symptoms. Right. You feel sick, nausea, want to throw up. You're shaking, you're sweating, you have dry mouth. Those are the physical ones. But remember that there are the emotional ones. The emotional ones are the ones that you cannot sleep.
You need problem. You need help with. Got it. Okay. So, I'm ready. Just tell me when. Physical symptoms of anxiety.
So you look at it. You just keep your book and you go.
And let me just say.
Give me a smile.
Let me just say though, there are different forms of anxiety. I don't want you to think that just because you're going through and you know what anxiety is and you know you're suffering, that there's just one type. There are different types. And let me give you a few. Like there are physical symptoms of anxiety. And I talked about the fast heart rate. That's one. But there's a sensation of having a throbbing heart rate, palpitations, so to speak, where you just can't even slow your heart beat down. That's a physical symptom. And nausea, feeling sick on your stomach, that's another one. That's a form of anxiety too. When you get into a certain situation, or you're around certain people and you're dealing with certain concerns, then that sickness, that nausea takes over. That's a form of anxiety as well. Shaking, when you get nervous, that's a part of it. You're shaking of your body, sweating profusely. I mean, you just walk into a room and all of a sudden You know, you just started sweating. You can't even stop yourself. You just started sweating. Dry mouth. You know, you're around people, you're in a group of people, and you can't talk because your mouth is so dry till it feels like the Sahara Desert. That's another form of anxiety. I don't want you to think that, you know, anxiety is just this mental illness. It can be a part of life too. And sometimes we need help to deal with life. So you do need help. You do. If you need help, you know, your chest pain can be anxiety. People have chest pains because when they get to a certain place in life, or somebody's asking them a question that makes them uncomfortable. You have headaches.